If someone has received radiation therapy to the left side of the chest for breast cancer, that can slightly increase the risk of developing heart disease later in life. This happens because of the heart, especially the front part, is closer to the left breast and might get some exposure during the treatment. Even with modern methods that aim to protect the heart, there's still some risk that builds up over time. For people who are already at moderate risk for heart disease, like someone with mildly high cholesterol or blood pressure, this added risk from radiation might tip the scale towards starting the statin. Statins are medications that help lower cholesterol and reduce the chance of heart attacks and stroke. Usually, doctors use calculators to estimate your 10-year risk, but these tools don't include cancer treatment history. So, in cases like this, the radiation counts as a risk-enhancing factor. In fact, research now shows that statins may actually help protect the heart from damage caused by the radiation. Studies suggest hydrophilic statins like a pravastatin or rosuvastatin may work best, and that taking a higher dose can offer more benefit. That's why American Heart Association and other expert groups recommend being more proactive with history of left-sided breast radiation. If you are in that moderate risk zone, say with a 10-year heart disease risk between 7.5 and 20%, and you've had this kind of cancer treatment, it makes sense to lean towards starting a statin. It's especially important if you also have other risk factors like smoking or of diabetes or a family history of heart disease. It's also about lowering your chances of problems down the road. This is where shared decision making comes in. That means having a real talk with your doctor about the risks and what matters to you. Together, you can weigh the pros and cons and decide whether to start or adjust your statin. The good news is that this approach is backed by strong research and is one more way to stay healthy after beating cancer.